He was texting me. He has some issues to log
Okay, I
in.
believe we are live now. Hopefully we have our missing guest join us soon. Welcome to this session. I'm really excited. I'm afraid that we just talked about Benjamin Button. I'm afraid you've got some people doing the opposite here. I'm afraid we're not getting any younger. But we are very excited to be here. And it's interesting that next normal is the theme. I would argue that next normals should be perhaps the theme, because it's certainly true that we are not going to end up in a single place. We are going to continue to face uncertainty going forward. And I would argue that we need a strategy that is going to be appropriate, not just for the short term, but for a continued period of uncertainty. So we've called ourselves Happy Hybrid or Sad Silos, and I'm pleased to say that our mystery guest has now joined us. Good to see you, Rav. So yeah, we called this Happy Hybrid and Sad Silos. We chose this title because, in all honesty, there is a lot of polarity in how companies are faring today in the pandemic. Some companies are doing well. Some companies are doing less well. I spend a lot of my life doing research and talking to executives from around the world. And I really see a strong gap opening up between those that can do well. And of course, one of the biggest challenges is in information and personalization. And that's something we believe that we've already heard in the last hour is a key focus for many companies. But it's also a key focus, I think, where technology can help. We also heard that technology is not important. I disagree with that. I think that we need to be able to embrace technology in a confident way. I think that we need to be very technology savvy within our companies. And I think that the next generation of companies which are being built today, you may not be able to see them yet, but they certainly are being built today, are very much the products of this new era where, once again, the internet has become more ubiquitous, as it did 10, 20 years ago, that birthed the Web 2.0 generation. And I do believe that we're going to see a new generation. And it's futile to say that, Facebook or Uber or Airbnb are not technology efforts. Of course, they're very strongly technology efforts. So we do need to prioritize and understand that in order to make a real differentiation, a real impact on our market, technology needs to be embraced. The other thing is that information is exploding in the pandemic. Some sources claim that medical information is doubling every 70 or so days. And the idea that the human consciousness can somehow absorb and make sense and communicate and inspire people with this information is, in my opinion, ludicrous. So it is absolutely the case that anybody, HCPs and our internal staff, are going to be overwhelmed by the incredible technology mountain, the incredible information mountain that we are facing today. And that holy grail that we talk about, that relevance and that personalization that addresses the individual's needs, brings that right content that helps decision-making to really improve care on an individual level, and therefore really drive patient outcomes, is something which technology will have to assist us with. So we know that a hybrid model is the way forward. We don't need to talk about that. We know it's going to be an online and offline blend of customer engagement. But what do we actually aim for now? What is the version of the hybrid model that we are actually obtaining? I think a lot of companies are doing exactly the same thing. You saw how much agreement there was on the panel. Agreement is not necessarily a bad thing, but I worry that companies are going to be able to differentiate themselves going forward. And what are the tools that matter? What are the tools that actually allow this personalization to become a reality? Only a third of executives are currently satisfied with their multi-channel efforts. So something that's according to Across Health. There's something wrong. There's something wrong. So that hopefully gives you a little bit of an introduction to what we're doing today. And of course, we're going to embrace technology in this session. We're going to embrace AI in this session. And to begin that journey, I would actually like to introduce Rasim first, who works for a company which I believe is really emerging today as a leader in this space, and actually doing some really quite exciting things that aren't just technology pure, that do absolutely take into context the critical customer and critical internal considerations that we need to make. But let Rasim explain better than I can about his company and why it's an important component of this conversation.
Great. We don't have slides, right, Paul? So I'll just won't wait for them to come
okay. Apparently not.
Okay, cool. So Okra AI, some of you will have heard of us, AI machine learning company, obsessed with life sciences is what I would say, right? And for the last 5 to 6 years, understanding all the data components that can actually address some of the points that Paul has already mentioned with regards to personalization. But what I would say is very different about us is that we are building AI brains for our pharma clients, as opposed to, just deploying products, right? And the use of the word brain is intentional because I think, much like humans that learn over time, right? From the moment we're born to where we are now in our careers, through our experiences, through traveling, through reading, and all those data points that we harness over time, our decision-making changes, it improves. We embrace the unknowns, we embrace uncertainty. And that concept and that philosophy for life sciences, I believe, is absolutely important, right? So everything we do at Okra is about being outcome-based, right? So we're optimizing the outcome that our clients want to drive, whether it's predicting price, benefit outcome, or in this case, HCP engagement. But much like we reach decisions as humans, we're able to explain, even if it's gut feel, we're able to explain where these decisions come from. And this is something that we won't compromise on. And I think that industry shouldn't compromise on in terms of being able to explain how algorithms have derived at a specific action recommendation or suggestion. And it's something that we certainly worked on building alongside deployments of our AI brain. And I think the third component for us and the industry, which is very important, which may alarm some though, is that we are totally data-driven. And what I mean by that is, let me answer what we're not. We don't use rules, right? We're not confined by your brand plan or your marketing plan. That is certainly not our entry point, because every time that changes, you'd have to rebuild your brain. And if we as humans had to constantly rebuild our own brains from the start, it would be very difficult, very challenging. So we need to evolve as the landscape changes, as we learn from our outcomes, as we learn from our actions, and as the data itself increases. So that's kind of our philosophy in what we do and how we approach this very complex challenge of personalization.
Can you guys see my screen with the slide?
Yes.
Thank you for that.
Good. Glad to hear it. So Raz, do you want to move on?
Yeah, well, I thought about maybe giving Dennis an opportunity there as well to come in on kind of...
Dennis, please do continue and tell us about AWS, a company that we've all heard of, but I believe that we don't know too much about. So please do express how AWS is working in life sciences today.
Yeah, thanks, Paul. And for those who know me, before I joined AWS now close 2 years ago, I was spending more than 20 years in the life science industry. And I'm not a typical tech guy. I'm a biochemist by education. And what really motivated me to join a tech company was to use those kind of technologies to decipher the complexity of biology. So that was something I was very much thrilled by, so that really helps to provide better care experiences for patients. And when we talk about AWS, a lot of people know AWS. The company is around since 2006, where Amazon Web Service started the first service. We have a dedicated healthcare practice now more than 8 years. I think what's quite interesting about our healthcare practice, the people working in this practice have on an average 17 to 18 years of experience from the life science and healthcare industry. So we really walked in our customers' shoes and working with our customers to address some of the toughest challenges in healthcare life science. And we work with our customer really along the value chain that reaches from lab to life, from early research and discovery over clinical development. As you all know, there's a lot of interest now. How can we make clinical trials more patient-centric? How can we move them really to the patient's home? We are working a lot in supply chain manufacturing, where it's all about how can I get a better transparency on my shop floor with better data, really learn and move to things like predictive maintenance, reduce my cycle times, and improve also my working capital. A lot of interest there. But what we talk today about is more all the commercial workloads in the space of digital health, digital therapeutics, where we also do a lot of work. And what you see there on this slide are a couple of areas where we are currently working quite extensively with our customer, really to leverage the value of data and put our machine learning capabilities on those data to create actionable insight. So in the panel before, the panel also discussed about how can we, for example, use data to better understand also patient disease journeys. So that's a typical use case where we are, doing a lot of work with customers using machine learning capabilities on top of de-identified longitudinal patient level data. And why is it so important? Because it really helps you to predict disease progression, to better understand disease journey of patients, to better intervene then at the micro moment of truth. So there's quite some work we are doing in this space. Then if you look at physician really helping providers, we are doing quite some work in terms of physician decision support. As you said, Paul, physicians are really overwhelmed at the moment with the explosion of medical knowledge, medical data. So I have seen a report that a physician would need to read 29 hours per day really to keep track with all this medical knowledge, which of course is not feasible. And then on top of that, also technology drives a lot of new data which are generated when we think about multimodal data sets, multi-omics data, really to get a full understanding of the patients. And there's quite a big need really how those data can be really ingested, but processed, and then really also insights can be really unleashed from all those data to help physicians to better decide what's best for their patients and help them on their care journey. So there's a lot in this area in terms of enabling physicians, augmenting them with the power of AI/ML. Then I think also what was discussed in the panel before, I believe we are still in a very much information-rich industry, but inside poor industry at the same time. So we are buying so much information. We have so many data, either internal data or licensed data. But the matter of the fact is that often we see organizations really struggling to manage all this information and really to create insight of all this information. So one area where we're also focusing on helping customers is really creating what we call insights at their fingertips, really democratizing insights across the organization, and in particular for field teams, where Raz also will spend some more time, I believe, later and explain what Okra is doing in this space. We believe it's super important because we need to better enable the field teams, because if we would really like to deliver against the promise of personalization, field teams need to have all the breakthrough knowledge, which really then can be translated into better customer experiences. And the big issue is, how can you really bring this knowledge to all those field teams that they can really use this in their customer conversations to create more relevance. So there's a big need really also how technology can help and bring this information to the right people and to democratize this information across the organization. And then the last two pieces here, you see, of course, personalization at scale. I think it's a little bit a big buzzword now also in the industry. So Amazon.com was innovating now personalization since more than 20 years. We have a lot of customers coming to us and say, could you help us? We would like to engage like Amazon. What I can tell from my own experience, this will not work overnight. So there's a lot of foundational elements needed really to deliver against personalization. So the data foundation is super important, really to have actionable data, which you also can then fuel your AI and machine learning systems. But we are doing a lot of work with customers, really help them on that journey to achieve personalization. And last but not least, an area I'm personally very much excited about is how we can also use technology to improve the care experience of patients. I think we need to move out from delivering care to patients. We really need to think about how can we build a care ecosystem around patients. And there, of course, Amazon and AWS are doing a lot of activities also with, the Pan Amazon ecosystem like Amazon Care. We are very much focusing really how can we deliver a better experience for patients.
Okay, so lots of stuff. I'm going to stop sharing slides now. Does this work? I don't know. What are you looking at?
Yeah,
yes,
that's good.
It's hard to know what everybody's seeing on the screen, but that was a great whistle-stop tour. Thank you so much to both of you. It's probably worth pointing out that AWS and Okra are actually partners as well, addressing these challenges together, and also that Okra is tomorrow, I believe, hosting its first demo day. So if you haven't already signed up to that, make sure you have a look. Just go to okra.ai. I want to ask you guys a question because time is flying fast. I want to ask you about, you're both at the front end, they're on the coal face of personalized customer engagement. And what is the reason, despite the tools that we've all been expressing, what is the reason that we haven't achieved this yet? What is holding companies back from this? Why can't we actually make use of these tools and create the results that we want?
Yeah, maybe I'll chime in. I can kind of bucket these into probably three areas, and I caveat that with there has been good progress, right? But what is still holding us back? I think one is legacy systems, right? And Dennis alluded to it, right? We've got probably a data-rich environment within these legacy systems, but insight poor. It's hard to extract that information out of these systems and then generate the real intelligent insights that are actually going to lead us to this promise of personalization. And instead of looking at alternatives, we may end up trapping ourselves into the idea of let's just bolt on more and more stuff to this system. And I definitely know the number of requests we're now getting of how do we attempt to challenge this is increasing. I think the second area that I'll go into, there's still huge confusion around what an AI solution actually is. And I'm talking deep learning, neural nets, machine learning, time series analysis, all of this bucketed together. How does this turn into a productized solution, right? We've still got people who believe their solutions are AI when they're not, right? They're confined by rules, they're confined by brand plans, traditional metrics. This is not AI. I'm not here to burst that bubble, but I'm going to, right? And I'll challenge individuals on that. That is not, if you have rules defining what you're doing, this is not artificial intelligence. This is just traditional ways of working. Then you've got, I think, companies who've gone through this phase of let's internalize the capability. Let's build data science teams. Let's become data science companies. I do applaud this. It is very encouraging because it means there's been a big shift. But what we've seen happen is this leads to more one-off projects, pilots, small-scale delivery. Actually, it's increasing internal frustration because you've got a battle now with individuals who want to move fast and scale, but then you've got this small core group of people responsible for this now internally, right? So it's slowing everything down. And then the third area is when you've actually got companies who really pride themselves on being data first and automated pipelines and feature extraction, insight generation systems. You've got companies who still believe they don't have enough data, which is not true. There are data gaps out there, but you've got to understand how this data maps together, how you join it, where the data gaps lie, and the expertise from companies out there that can help. The final point I'll probably make, and I'll pause for breath after that, is there is, for me, from all the conversations we have across different pharma companies, a very different definition of what it means to be actionable intelligence, or what is actionable intelligence. In many cases, I think that definition hasn't evolved, right? 3-4 years ago, it should have been frequency driven or quota metrics, number of calls, drive the number of emails. but we're still there today. And for me, that's ludicrous, right? That means we're looking at just activity data really, and some clicks on some of our websites and other assets to drive actionable intelligence. We're forgetting disease prevalence data, demographic data, trial data, publications data, and how all of this can guide us to data points and HCP unmet need that really will be the core of the brain. And I go back to the brain. What does it mean to have a brain? It learns over time. It adapts. It navigates the uncertainty. So I think those three, and then we can probably bucket change management for 3-hour call next on the next webinar. But that, I think, is the other one.
Can't wait, Raz. No, okay. So you've made some good points there. You're basically saying, yes, we need a learning mechanism, and frankly, there are too many data sources for the human mind to comprehend, and if we're not including those, then we haven't actually achieved true commercialization, personalization, because we haven't actually absorbed all of the information required to personalize. Okay, making sense. Dennis, do you have anything to add?
Yeah, first of all, I echo what Raz said. So when we are engaged in a lot of different projects with customers, really to solve on the data foundation, what we often see is that the systems which are used infrastructure in commercial, this ecosystem is often very rigid. So it's not flexible and not agile enough, and the systems are not really adapting to the different functions we have in a commercial organization, or even then to local markets that have specific data requirements. I believe that is an issue. Those systems that they are missing this agility and flexibility you need really to provide this very much personalized experience, which also can be different from market to market, because the needs also of customers based on the health ecosystems are different from market to market. So that's what we definitely see as one issue. Then what Raz said, we often see that data is really siloed across the disparate systems, and then the organization is not able really to combine then these multiple data types from across all those different channels into a central data system. And that means at the end that the data is not really liquid, it's not interoperable across the organization. And that, of course, is preventing then, if data is not liquid, that you can start then to put advanced analytics on your data and really learn from the data and really continuously also learn from data what customer really need and how you can improve their experience. And also when we work then with the different teams, MSL teams, for example, reps, they often tell us also it's so much overwhelming and really complex also to work with the existing systems. It takes a long time really to pull data because a lot of different systems are involved. Then and really then to get the ground really of what we would like to know, really to understand the sentiment, the trend, the patterns, really what is happening there with the customers, and how can they use this information to provide a better experience to customer, really to get this full 360 view of customers. I believe that is also, it sounds easy, but it's super challenging for life science organizations to achieve, and that's a lot of our work we are doing there, really to help them to ingest the data, unify the data, process the data, so that they really have the foundation then to put then advanced analytics and machine learning on top of this data. So these are a couple of challenges we very much hear when we work with our customers.
Great. Thank you. Really strong answers, and interoperability and data liquidity, obviously, and very defiantly something that we need to improve. And I'm really glad that AWS is here to help us with that in our industry. I want to play devil's advocate, if I may, for a moment, because the truth is, AI is like many new technologies. It's going through a hype cycle, and people have been disappointed with many of the things. That's why, Raz, you had to say that it's not even real AI in many cases. And these disappointments, the expense, obviously companies that focus on IT solutions like yours, there's always a new upgrade, there's always a new budget request. So it's a never-ending journey, an uphill battle for many of us. Where has real results actually been produced that we can point to? Have we got any great case studies for our industry that we can point to and indicate that this is actually working? And how do we bridge the gaps between the legacy systems that we don't necessarily want to destroy and rebuild all over again in order to sort of enhance what we have today. So how do we be pragmatic about it, I guess, is my question. Rad, do you want to start first?
Yeah, I'll start, and I think it's a very good point, right? So around the case studies, and I think you can look at the success of case studies in two ways, and I'll split them, right? So one is the if we're looking at commercial, maybe it's about sales uplift, maybe it's about change in behavior, maybe it's about opportunity identification. What is the value to the business in hard numbers, okay? Or in the medical side, how are we going from raw call notes from MSL interaction with stakeholders to global insights in a therapeutic area in order to drive medical strategy? But for me, the bit that we always miss is how have we been able to map and connect multiple data sources? Have we been able to achieve true automation? How accurate are we? How much maintenance do these systems require, right? So legacy systems require a huge amount of FTEs. AI systems shouldn't require more than half a day per month individual working on it to maintain it, right? So I think case studies that I've certainly been involved in with multiple clients have achieved the business value, right? Where we're driving behavior, where we're driving sales, or kind of identifying unmet need from hundreds of thousands of notes and distilling that down in a matter of weeks to actionable insights. But the brain, the bit that's going to drive competitive advantage for your companies, is making sure that brain is fully automated, that the constant validation is going on month as new data comes in, that you can maintain the accuracy above 90%, that you can explain where these suggestions are coming from. Because if we're going to drive trust on an industry that's built on clinical trials where we have evidence of our drugs, we need evidence of where our algorithms are getting these suggestions from. So I think it's twofold. We see a lot of, we doubled sales, vendors coming out with a lot of, these strong claims. The bit we never see is it automated? What was the accuracy? What was the change in data? Was there a launch midway through that when your models adapted? We never see that. That's why explainability, glass box promise has to be something that we push forward.
And perhaps, if I may add something to that, what Raz said, Paul. So first of all, because you said where have AI really, also shown value? One big issue I see, sometimes people jump on AI without having really defined, the problem. What kind of problem AI should really solve? And if you look, from a commercial perspective, there are definitely some tangible use cases we have seen now where we do a lot of work with customers together with our partner Okra. So Raz said, for example, unstructured information. So that's, for example, free text, which is going into CRM systems from all the field teams. And why is that super relevant? Because, think about a big, Salesforce organization, the MSLs engaging, a pre-launch with customers. There's so much valuable information. But if you put that, of course, in a free text, that's, first of all, unstructured information. If you don't then have the technology really to make sense of this data, really to mine through all this information to understand sentiment trends, it's a huge missed opportunity for an organization really to learn from that data and democratize this insight across the organization, really also to optimize your launch strategy. So that's a classical case where we engage with customer pre and post launch. And also another case, just to show where those insights can really help you, it's about segmentation and targeting. We think how we have done that in the past, using data, which sometimes is a look in the mirror. Now you can really use de-identified electronic health records claims data. You can use natural language processing, machine learning, really mining through those data. And why that is important? Because you get a very good understanding about the patient disease journey. You can really flag then physicians who have, those patients progressing in their disease and potentially having a bad outcome. And you can really then also guide your organizations to go to those, physicians first, really to help those patients in biggest need. And I believe these are great use cases which show the power of AI ML. And I believe at the moment we are only scratching the surface. There's so much to come where really this technology can really help also in our industry, that we create more value, not only for patients, but also for the healthcare providers, because they also need to have better systems because they are burned out and we need to better help them in their decision making as well.
Great. That is a great answer, but I'm acutely aware of time. We've only got 1 minute. Fortunately, I don't see a question, so it gives me that 1 minute to maybe just quickly ask you, you guys have collaborated together. What, from a customer's point of view, is that going to provide that might have not existed before? How can a customer leverage your partnership? You're going to have to be very succinct in your answer so we don't go over time.
Yeah, I'll maybe summarize it to 4 very key points. I think first, validation of our AI, ML, everything we do in terms of the components of the brain, right? AWS is a very well-known player and has validated what we do. Speed of scale. A lot of clients are built on AWS, so are we. You bring that together, you scale much, much faster. The data ecosystem, I think that's already been mentioned. It shouldn't just end with 2-3 data sources. This needs to build over time, and actually now giving clients a proper AI-based choice. That's, for me, the biggest thing. It's there, it's now, it's not a promise for tomorrow.
Great. Dennis, you've got about 10 seconds.
Yeah, and to add to those points, it's I think the experience. I always say that there is no compression algorithm for experience. So, AWS, it's the most experienced cloud provider. And I would also add to that, it's the ecosystem we can provide from the Amazon side. Because I personally believe at the moment we are so much focused on, the singular, AI ML use cases. In the future, we need to think about how we can use this to evolve the care paradigm. So also things what we are doing on the Amazon side, like Amazon Pharmacy, PillPack, Amazon Care, Alexa Health Skills. Really, if you think about integrating that in a broader ecosystem, I believe those things will become super important in the future.
Thank you so much, guys. Really appreciate that fast-paced session. Hope you listening at home managed to get something from it. Obviously, follow up with either of these guys if you want to know more. I would very much encourage it. We have to embrace technology. Thank you so much to Dario and the team for letting us on. Appreciate it.
Cheers.
Thanks, Paul, for the moderation. Bye-bye.
Bye.